These days, most of us understand the importance of presenting ourselves well, both in our careers and our social lives. We're also aware of the importance of good health and well-being. Onychomycosis is a fungal infection of the nails, which, although unsightly in appearance, is far more than a cosmetic problem. Nail fungus can cause discomfort, loss of dexterity, and can lead to more serious conditions, particularly in diabetes. Fungal nail infections can also cause psychological and social limitations. Fortunately, nail fungus is now a condition that doctors can successfully treat. Hello, I'm Dr. Kerryn Phelps. Onychomycosis is a very common ongoing problem for many people who've not yet found the appropriate treatment. Today's program looks at what causes nail fungus, what treatments are currently available, and why you should see your doctor so that you may avoid the embarrassment and discomfort associated with unhealthy nails. So what is onychomycosis? We asked Dr. Rob Rosen, dermatologist from Sydney's St George Hospital.
The medical name for nail fungal infection is onychomycosis. It is a stubborn fungal infection that rarely goes away by itself, and if left untreated could eventually deform your nails and lead to more serious conditions. The nail looks abnormal and it can have various colour changes such as yellow, white or brown. It can also look very opaque. The nail can separate from the nail bed and grows thickened and gets very brittle. There can be a distortion and twisting of the nail as well. There are other nail diseases that look like fungus but are not, and these can be ruled out before proceeding to effective treatment. Your doctor can arrange simple and painless tests to confirm the diagnosis of onychomycosis. This involves collecting a sample of the infected nail and sending it to the lab for testing. Fungus of the nail is caused by microscopic organisms, similar to the ones that cause athlete's foot, but it is far more persistent and more difficult to treat. The difference between athlete's foot and nail fungal infection is that athlete's foot involves the exposed skin, while the nail fungal infection involves the nail bed, which is hidden underneath the nail. While athlete's foot usually responds to surface treatments, fungal infection under the nail may not.
When I first started having problems with my feet, I thought it was just athlete's foot. I'd often had tinea problems before, especially in the groin area. And one day I was putting on my socks and I discovered that my big toenail was becoming quite yellow and it appeared to be thickening. I didn't pay much attention until I began experiencing pain when wearing shoes, and especially when I was out jogging. So I went to my doctor and I asked him about the toenails, and he told me that the fungus was growing underneath the nail and that as the nail grew out, the fungus was growing with it. And so when I tried a cream, it didn't work.
I had a fungal infection of the fingernails on 3 fingers on my right hand. I used to cover it up by having false nails or always wearing nail polish. It was really embarrassing to be seen without nail polish covering up my nails. I had it for 2 years before actually realising there was a treatment available. My doctor also told me that it's highly contagious and you can spread it to other family members really easily. I was put on the oral treatment because it gets down below the nail where the infection is.
The fungus involved with nail infection is around us all the time and can be found in our clothing, in shoes, in carpets, where it can live for 2 or more years, at the gym and in the soil. In any of these situations, nail fungus can spread from one toe or finger to another. Nail fungus is contagious and can be easily spread to infect other family members.
I didn't know where it came from at first, but I found out when you go swimming or if you go in a locker room and you don't have any shoes on, you can just pick it up like athlete's foot. It actually spread from my big toe to the little toe of the same foot. It was embarrassing, especially at the beach. I used to cover my toes over with the sand so no one would notice.
Nail fungus is difficult to treat because it lives within and under your nails and is shielded by the hard nail plate. It lives and grows in the channels in the nail bed. Without proper treatment, onychomycosis can continue to spread and eventually can even deform or destroy your nails. We asked John Bell, well-known pharmacist in Sydney, what treatment options are available.
We have a number of ways to treat nail infections. For very superficial cases, topical creams and paints can be used directly onto the nail. With these preparations, it is important to follow the directions exactly, as it may take 12 months and beyond to get good results. You will need to use these products long after the infection seems to have gone. Most cases of onychomycosis are not superficial at all, and to treat them properly we must get the fungicidal medication under the nail where the damage is being done. The more effective oral preparations are taken once a day, and so it is a convenient form of therapy and it's not messy. Nail fungus is very stubborn, and so you must follow your doctor's instructions and take the complete course of therapy. These tablets have been tested and used with a number of commonly prescribed medicines, but it is still very important to tell your doctor or pharmacist about any other medications you are taking.
Oral therapy works by travelling through the bloodstream and attacking fungus where it lives, deep at the base of the nail. This way, an oral fungicidal can reach the infection, kill the fungus and prevent it from spreading.
Doctors can prescribe oral medication for fungal nail infection. These tablets have been successfully used worldwide by millions of people. In the case of fingernails, oral therapy is taken for 6 weeks, and for toenails it takes 12 weeks. This is because fingernails grow faster than toenails. After you complete the course of treatment, it'll take some time before you see your nails looking completely healthy again. It may take 6 months before your toenails look normal, and 3 months for fingernails.
Well, I'm delighted that I don't have any pain in my big toe anymore. And it's important to me because much of my work is standing on my feet and walking around, and it did get painful. And I don't experience that discomfort now. And it's good not to be self-conscious when going barefoot at the beach or changing your shoes at the gym.
It's great to be able to go with that nail polish and to look more natural and not feel embarrassed with unhealthy looking nails. We've just had a new baby boy, and so I'm doubly pleased not to have the risk of infecting him or the rest of the family.
Living with nail fungus is not a pleasant experience. This condition can have other serious consequences, particularly if you have diabetes or peripheral vascular disease. It can be embarrassing, uncomfortable, and affect the quality of your working and social life. Here are some useful tips to protect you and your family against reinfection. Trim your nails, leaving some nail for protection. Wear shoes that are roomy enough for your toes to move around in. Change your footwear every day and wash your socks and stockings thoroughly. Always wear gloves when you're working in the garden. If you happen to have athlete's foot, talk to a doctor or pharmacist about treating it. If family members or friends have nail fungus, encourage them to seek treatment right away. Modern therapy may mean you don't have to tolerate the embarrassment of nail infection anymore. Ask your doctor if oral therapy is right for you. Thanks for watching.